Morning, everyone. Thanks for joining us today. Money pays for health care, so let's talk about money today. 4 years ago when we came to government, we inherited some enormous debts, and we thought that we had a problem to clean up, but we've got a new problem. We are the most indebted province per capita in Canada. Last year, we paid a record more than $1 billion in interest on our debts for the first time in the history of Manitoba. And all of those taxes go to moneylenders. They do not go to frontline services. They do not fill a pothole. The burden our children and grandchildren are going to inherit is large, and let's be clear, it is about to grow. The COVID-19 pandemic has shut down the economy, and Canada's strong economy has always paid for Canada's strong healthcare system, but not today. Governments have always used the taxes that you pay when you buy things, when you work, from your small business to pay the bills. But that isn't going to work now. And so now governments are struggling to find the money from other sources, from somewhere else, while the economy suffers. And borrowing more money for Manitoba's future, from our own future, and from those generations who follow us is, frankly, the only way we're going to get the money we need right now. Borrowing from those we love, borrowing from those we care for, most of all, so that we can provide for those we love and those we care for today. That's where we're at. Let's be honest about it. So, Manitoba's about to take on, as are all the other provinces, some new debt. I call this Manitoba's pandemic second mortgage. Every province is in the same situation. We've worked diligently for the past 4 years to build up a rainy day fund. We're using that now. We worked hard to build it up, and it's going to dry up. And when it does, Manitoba's borrowing will begin in earnest, out of necessity. The facts are these. Every province will be looking for money at the same time, and that's going to drive up our costs even further. Every province already pays more than the larger federal government does to borrow, and those differences in interest costs will widen. And Manitoba will pay double or maybe even triple the federal government interest rate on its second mortgage. So here's a Manitoba idea, straight from the friendly Keystone province. The federal government should act as the intermediary for all provinces in their borrowing. They should coordinate this national emergency response. They can borrow at much lower rates, and they can pass those savings on as a service to Team Canada. Le gouvernement fédéral pourrait servir d'intermédiaire et coordonner cette urgence économique nationale. Ils empruntent des taux inférieurs et peuvent répercuter ces économies en tant que service à Keep Canada. This could save Manitobans, for example, in excess of $1 billion in just the next 10 years. This Federal Emergency Reserve Savings Team concept would be the first of its kind in Canadian history. A common sense, friendly Manitoba suggestion. Lower interest payments mean more money for health care, now and in the future, and a lower burden on future generations too. The choice is simple: stronger banks or stronger health care. Moins d'intérêts signifie plus d'argent pour les soins de santé et est un fardeau moins lourd pour les générations futures. Le choix est simple. Banks plus solides, soins de santé plus solides. I know Manitobans agree. I know experts agree. I know all the premiers agree to. I know the choice is clear to all of us. First pandemic, first solution. The Federal Emergency Reserve Savings Team is good for our country and for all of us and for future generations as well. After all, we are all in this together, all provinces and the federal government. We are, and we must continue to be, Team Canada. And together, we'll beat this thing. I'd be happy to take your questions.
Thank you, Mr. Premier. First up from Global, Brittany.
Good afternoon, Mr. Premier. This was something that you had announced last week, and I'm just wondering if you've already had a conversation with the Prime Minister about this and where that's gone so far.
Well, I would say, first of all, we've had the conversation as recently as Friday, Brittany, but not since, and I wouldn't want my comments to be taken as accusatory to the Prime Minister for not responding more rapidly, because he's only really been aware of this proposal, I expect, for a few days. But again, it just makes such good common sense. The chance for us to save money on interest and the chance to redirect that interest into healthcare is what we're talking about. So I'm very hopeful the federal government will respond favorably. All the premiers that were on the call, all the premiers, quite frankly, are unanimous that this is a service that they believe can be very helpful to them. And of course, to varying degrees. Different provinces have different fiscal situations and fiscal needs. But the point is that the money saved can be used either to strengthen the bank's balance sheet, or it can be used to strengthen our ability to provide health care to our citizens.
And my follow-up is on masks. 3M is located just south of us across the border. Premier Doug Ford in Ontario coming out already saying that they've seen masks that were stocked at the border. What are we seeing here in Manitoba, and what's your message to those south of the border on stopping any shipments of those masks coming to Canada and to Manitoba?
Well, Brittany, I know that the doctor will have more to say to you in less than an hour on specifically on protective gear and equipment. I can only say that I think I understand, and I hope that most Americans understand, as we do in Canada, that our trading relationships over the years have been some of the best and strongest in the world, and that we should never let that border thicken, because quite frankly, we build things together more than we build them separately. So I'll always be concerned when I hear comments such as those from the President late last week.
Thank you.
From the Winnipeg Free Press, Larry.
Mr. Premier, Larry Cush at the Free Press. I'm wondering if you've given any thought to what at least one province is considering, that is the topping up of assistance, direct assistance to people on EIA during this crisis. Is Manitoba about to announce something along those lines?
Well, Larry, we have, in terms of topping up, we have a program that the federal government has kicked off this morning at 6 a.m. to provide up to $2,000 a month for people who don't have other sources of income. And within our public service, we have some of the most generous contracts for vacation pay and for sick time in the country. So, I wouldn't want my comments to be taken as anything representing a lack of appreciation for our workers in government, but I would say that our supports in existence today, plus the federal plan that we'll be encouraging participation in for those who need it, combined offer a tremendous base of security and confidence for people, in particular in the public sector.
People on welfare.
Well, again, the province of Manitoba has never had a budget as large as this government has for people on social assistance. That's one of our largest and fastest growing categories of expenditure in our provincial budget. We've almost tripled the amount of money available to support people in respect of rent. The Rent Assist program itself, we anticipate, will be significantly increased in its subscription and is, as I said earlier, just about not quite triple what it was when we came to government. So we've continued to direct resources to our more vulnerable people. And that was, I think, in part the theme of our announcements on our programs last week as well. Late last week, we announced programs to offer some greater, we hope, confidence to those, in particularly the most vulnerable in our society. And that's where our focus will continue to be.
But just to follow up, so you're not looking at increases in social assistance rates at this moment?
As I said earlier, we have some of our largest contributions, and certainly larger than any previous government by a significant amount, are going to those on social assistance right now. But there are also a great many other Manitobans who need help and support, whether it's frontline healthcare workers or people in the private sector who've lost their jobs, small businesses that have gone, been forced to close down because of our decisions to protect the health and well-being of all. We're all in this together, and there's lots of pain to go around. I understand that. But again, our focus has been on continuing supports and growing supports for those who are more vulnerable in our society, and we're continuing to do that with, for example, the announcement of additional secure spaces for homeless people last week and that type of thing.
Thank you.
From City News, Stephanie.
Good afternoon, Mr. Premier. Stephanie Lasuk from City News. We continue to hear concerns over people not self-isolating when they return from travel. I'm just wondering, is it time for Manitoba to look at stricter enforcement like some other jurisdictions have done?
It's a topic of discussion earlier today, and it continues to be a concern, as I expressed probably too bluntly late last week, but nonetheless, it is a concern when people refuse to understand the hurtful consequences of their thoughtless conduct. And so, yes, it is on the radar to see if there are necessary deterrents that need to be pursued because of this. Sadly, that's necessary given the reality that some are disrespecting the rest of us. Most are not, and I think it's important to remember and to take pride in the fact that most of our people in this province are tremendously respectful of one another and have been behaving accordingly, but sadly not everyone seems to be getting the message.
And just as a follow-up, what is currently being done? How many fines has Manitoba handed out, or what is currently being done to enforce the public health orders?
Mm-hmm. Yeah, well, as you know, we've had the call number, and we've had some input there, and there have been some follow-up, and inspections have been done. But I think you're raising a very fair point, and I think Manitobans expect now that there should be consequences for people that are being disrespectful to them and to their friends and their family, and to, frankly, the battle against COVID-19. So we're definitely taking a look at some additional steps, sadly.
Thank you.
From the Canadian Press, Steve.
Premier, it's Steve Lambert from the Canadian Press. There's a media report out of Quebec today that says Manitoba and Alberta have offered to send some personal protective equipment, masks and the like, to Ontario and Quebec to help out because their numbers are much higher. I'm wondering, is that true, and what, if anything, have you offered to Ontario and Quebec?
Well, the doctor may have more to say on the specifics of this, Steve. It's I must be frank, it's not to my knowledge been the case, though it has been at many times throughout Manitoba's history the case that we've stepped up and helped others, and we'll continue to be proud of that. But I'm not aware of the specific nature of any assistance at this point in time.
Okay, and as a follow-up, a number of groups have raised, a number of healthcare workers and allied healthcare workers have raised concerns about personal protective equipment that they're getting, especially in the field, those people who don't work in hospitals or nursing homes or other facilities, home care workers and the like. What assurances can you give them that at a political level that you will do what you can to ensure that they are given proper equipment, that they are given access to it and can change it as they work outside facilities such as home care workers going into people's homes?
Yeah, I think it's totally understandable that people are concerned about their personal well-being. So am I. And so we've been on this one from the get-go. As you know, we were the first province to sign on to the federal procurement initiative and placed our order early before everyone else. We're following other avenues as we need to expand on availability. Our concern is not just with those who are vulnerable because they've contracted COVID, but also with those who are trying to protect those people and do their best on the front lines of healthcare. So we'll continue to be focused on making sure that we do everything as a government that we can on a planet where virtually every single jurisdiction is after the same thing, which is greater protective, more protective equipment for their workers. We are doing the same and have been for some time. So we'll continue to do our best, and we'll hope it's not needed. I guess everyone hopes that. But we're preparing for worse than that.
Thank you.
From CTV Winnipeg, Jeff.
Hi, can you hear me?
I've got you, Jeff.
Sorry, I'm having trouble here. Mr. Premier, you said taking a look at some additional steps, sadly, with regards to social distancing penalties. Can you maybe elaborate?
Well, I'll elaborate later in the week, I think, Jeff. First, we've got to get our ducks together in terms of the rules and the constitutionality and the various and sundry requirements that we have to meet to be sure we're doing this properly. But there's a clear need. And I think, quite frankly, look, Manitoba, springtime, there's going to be some challenges out there. We all know that. This is a beautiful place in the spring, and people are going to want to get out. People are talking to me about cabin fever left, right, and center. They're going to want to get outside. I've seen in several parts of the city and around the province, I've seen more people walking than I've seen in years. And not everybody is necessarily religiously adhering to their guidelines. So there's going to need to be some coaching and guidance beyond the doctor and I and Ms. Siragusa every day telling you and repeating these messages. We have done some advertising. I know that many of the community groups out there have been advocating. They've been doing their best to educate people within their jurisdictions. We talked about this actually with some of the Manitoba municipalities as well. They're making efforts. So, all of us are on the team. Not all of us are behaving as if they are, though. And so measures are going to, that can assist in that happening or what we're looking at, and I'll have more to say in the not too distant future on that.
Okay, so my follow-up would be, are you looking at fines, mandating orders for people to stay home like we've seen in some states? And I don't know what every other province is doing, but are you looking at things like that?
Well, we're looking at what works, but at the same time, we don't want to adopt a practice that forces everybody to be treated as if they were less intelligent and respectful than they are. So let's put it that way. It's a tricky thing, isn't it? We don't make laws for the vast majority of people because they abide by respectful conduct without being told to. They don't need a law to tell them what to do. Unfortunately for some people, I guess that a financial penalty or deterrent of some kind is about the only way it'll click into them that they matter and that what they do matters to other people. So we'll have more to say on that in the not too distant future.
Thank you.
From CBC Manitoba, Bart.
Bart McKee, CBC. Mr. Premier, on Friday you hinted about closing the border with Ontario, potentially to keep people from going to Lake Country there, as people there have requested. And you've just mentioned about outdoors here. What are your plans? What is your desire? Makes sense in terms of Manitobans going to their cottages, trailers, the lake in general? There is already some consternation in cottage country about that. Could you please offer your thoughts?
Well, my thoughts are, and I'm sharing them with Manitobans, but I'm sharing them with a journalist who has an extensive love of the outdoors and has demonstrated it through his work over many years. This is This is a very, very tough issue to deal with. We have families that have been in close confines for now weeks who want to get away and to enjoy the beautiful things that nature offers us here in Manitoba, and perhaps for many Manitobans as well, northwestern Ontario. It's a difficult issue. My plan is to have some input from Premier Ford on this as well, to see where he thinks we should be going. You know, our number one concern, of course, has to remain and must be the containment of COVID-19. And so that is where the focus has to lie. And whether it's talking about parks use or leisure space use within the cities or travel. Dr. Roussin, I'm conjuring up right now, has always been saying, and will say again today, stay home. Stay home and be safe there, because this virus travels when you travel. And if we can contain it that way, and the fight that we're fighting is ongoing, it's not a sprint, it's a marathon, that's the best thing to do. In the short term, there is pain, much pain to go around, but the rewards are there for following the guidelines the doctors outlined. So I would continue to urge Manitobans to do just that.
And that's a follow-up to that, involving travel strictly within Manitoba. Once it's warmer, what do you think about people going directly to a park and not dealing with other people there, or directly to a cottage and coming right back within Manitoba, inside our borders?
Yeah, well, again, you're talking to a guy whose favorite leisure activities are pretty much all outside. Maybe that's a natural consequence of being inside all the time. I think a lot of Manitobans could relate to what I'm saying right now. And so making sure we balance that ability for Manitobans to have some freedom to recover from the confinement that they and their family members are forced to have right now is an important aspect of these considerations. Health is the number one concern, though, and the transferability of this virus in our parks and elsewhere in our wilderness areas and so on has to be a major concern. So balancing those two things is not an easy deal. I guess that's why I got this job, so I have the chance to make everybody angry when we make decisions.
Thank you.
You bet.
From 102.9 CHTM, Navi.
Good afternoon, Mr. Premier. Navi Ball with 102.9 CHTM. I believe a couple of weeks ago you expected the rainy day fund to be depleted in about 3 months or less. Is that still on track for that, or have there been changes?
I would say that's as close as we're getting, and that hasn't changed significantly at this point. However, there are so many moving pieces, I'm hesitant to give you a hard and fast rule. It would be like the Ontario numbers you saw last week with a 500% disparity from top to bottom estimates. Nonetheless, thank goodness that we set aside that money and it's available without having to bang a tin cup and go to lending institutions. We've got that money available to allocate to things like purchase of protective gear and equipment. We've got it available on short order and it's being used. But we do anticipate it gives us a bit of a margin. But then what happens after is why I'm raising this issue today and why I'll continue to raise it. It's a practical, common sense way for us to reduce our interest costs. Just every Manitoban who's ever negotiated on a loan, paid a credit card bill, or has a mortgage understands how important it is to reduce your interest rate on your debts. And I hope the federal government understands that that's important for provinces as it is for the federal government as well.
Mm-hmm. And are you able to speak to how much is currently in the rainy day fund, even just a percentile?
I can tell you that it started higher than it is, and it's going to go lower than it is now.
Okay, thank you.
You bet.
From CBC Radio Canada, Patrick.
Bonjour, M. Pallister. Patrick Foucault from Radio Canada. Just to follow up on Steve's question on helping other provinces with medical supplies. The reports in Quebec say that during that Premier's meeting last week with Prime Minister, you said you had the intention to redirect personal protection equipment to other provinces with greater needs. I understand you say you're not aware of any deal or shipment at the moment, but did you and Premier Kenney from Alberta said during that meeting that she had the intention to do so?
I've answered this question previously. I think you're dealing with a false report, and now you're alleging something was said in a conference call between premiers and the Prime Minister, which would require you to have bugged the call. So I hope that wasn't the case. I wouldn't think CBC would do that. That being said, I said earlier that no such assertion was made by me. The doctor may be privy to some other offers of equipment I'm not aware of, and Dr. Roussin, I'm sure, would be happy to answer that question if you ask it later on.
Okay, thank you very much.
Parfait.
From the Winnipeg Sun, Josh.
Good afternoon, Premier. This is Josh Aldridge with the Winnipeg Sun. Looking at that rainy day fund, rain, I guess, kind of being the big word here. We had quite a dump of precipitation on the weekend, and we're getting into that thawing season with potential for flooding. How much more pressure would a big flood put on that fund? How much does that make it that much more important that we have the funds available from the feds or from loans for that money?
Well, it is very important that we have the support from the feds on this model that Manitoba is proposing and that the premiers unanimously support, but I wouldn't want to use the potential for a flood to make my case. I think the case is made on its own basis, its own merits, and our flood projections are with a plus minus always. We're talking about Mother Nature not showing us in significant danger. That's no reason to be anything but prepared, and we are prepared. We've had good cooperation. Our Minister of Municipal Affairs, our Minister of Infrastructure have both, as recently as Friday, been on calls, as was I, with all the representatives from the rural municipalities. Obviously, this is a concern. They're the front line when it comes to defending us against flooding situations, and I commend them. I think that both my ministers and the municipal officials are doing a great job of staying in touch and being proactive on addressing the potential dangers.
And you said earlier that we've relied in the past on the economy to be supporting healthcare, not necessarily always the government supporting that. How much longer can we support that just on government funding? How quickly do we need the economy to get back going to support not just healthcare costs, but other initiatives out there to support people through this pandemic?
It's a real good observation you're making. I mean, with a strong economy, we can support the existence of government programs. With a weak economy, we borrow, and that borrowing in the past, excessive borrowing, is what we've inherited, which gives us, significant debt obligations for us and for the next generation. So, what we're attempting to do here is make sure that we're not just addressing the immediate needs for healthcare, but that we're also understanding that with the right approaches, such as we're recommending now, that we can strengthen healthcare for the future too. I mean, really, the choice is about whether you want us to pay more and have stronger banks, or whether you want us to pay less and have stronger healthcare delivery, because the provinces lead in the delivery of healthcare. And look, the government doesn't print its own money. There's not a tree in the back of the legislative grounds here that pops out money every spring or fall. The reality is that people pay taxes, and that money comes from our economy and from their willingness to work hard and to give up a share of what they make to help us support our social programs. So when the economy suffers, healthcare sustainability suffers right along with it. And we want to do our best to make sure that the short-term, mid-term, and long-term needs for healthcare are well served in our Canadian Confederation. So this is about building a stronger Team Canada, and we think it's an idea that has a lot of merit.
From CJOB, Diana.
Good afternoon, Mr. Premier. Diana from 680 CJOB. Western Surgery Centre is a state-of-the-art facility on Sterling Line Parkway. It's one of the best and most modern healthcare facilities in the province. It's currently closed, but we're hearing it's been offered to Shared Health to kind of deal with non-COVID cases right now and could actually handle patients staying there overnight if the government instructs the College of Physicians and Surgeons to allow them to do that. Why isn't that being done right now, and why are these kind of outside-the-box ideas being considered right now to get the best healthcare into the hands of Manitobans who need it during the pandemic?
Diane, I can't speak to the specifics of the facility you raise. I can only say we put out a call for help and have had literally hundreds upon hundreds of responses from Manitoba facilities, professionals, businesses, manufacturers, in terms of service needs, in terms of machinery, equipment needs. Dr. Roussin might be able to answer your specific question on the facility you raise, but I can only say that the response from Manitobans and from the companies they represent or that they are part of, and from individuals as well, has been really, really heartening. So I thank Manitobans for that, and I think that's definitely an indication of the kind of people we are here in Manitoba, that we rise to the challenge together.
And just as a follow-up then, obviously you said you can't speak to specifics in this case, but would it be consideration of the province to use a facility like this? I know obviously you have the RFP out for hotels for kind of similar purposes. Would you be looking at maximizing the use of kind of clinics like this?
Yeah, we're definitely looking at maximizing our partnerships with other providers, not just with central government or the people who work within government, but with private sector people as well, and volunteers as well. As you know, with the Help Next Door initiative, we've had thousands of Manitobans step up, and they're really doing a wonderful job. And I say thank you to them again as well. So no, creative partnerships with the private sector is obviously something that'll help us to be more resilient and to not just get through this, but move forward and watch our economy recover more rapidly than, well, perhaps some other jurisdictions may.
Thank you.
You bet.
And finally, from the Brandon Sun, Colin.
Hi, Mr. Premier. Colin Slark with the Brandon Sun here. I was wondering if the province is considering offering any direct support for municipalities hit by the pandemic.
Well, we maintain, and we had the great call with the AMM again the other day, we maintain some of the strongest support for municipalities in the country of Canada, and we have no intentions of changing that approach. Those are great people that work at the municipal level, whether on the staffs or the elected people. I've often said to the people who serve in the councils, whether it's in the city of Brandon, Westman, or right across the province of Manitoba, that they're the best deal taxpayers get, because they are right on the front line. They're hearing from people about their issues and concerns, and I think this is a good opportunity for me to just say thanks to all those folks that are out there doing that right now, because they're dealing with a lot of issues, not just COVID, but they're dealing with a lot of other issues on a daily basis, and so we thank them, and we've really appreciated their partnership. So we have no intentions of reducing our funding support for them. And I should mention too, just the initiatives we announced the other day, for example, taking the property tax, the PST off the property tax, is going to add some significant savings to rural municipal governments and give them a little bit more money to deal with some of the additional challenges that they're facing and that we're all facing, quite frankly.
No follow-up question. Thank you.
My pleasure. Just want to say thanks again to everybody. I'll have more to say on a couple of other issues tomorrow, but I do say again, thank you for your reporting and thanks for your work. And to all Manitobans, stay positive, stay together, keep listening to Dr. Roussin and Ms. Siragusa and do what they've asked you to do, and encourage others to do the same. And together we're going to beat this thing. Thank you.
Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're announcing one new case of COVID-19, bringing our total to 204 cases. The total number of deaths related to COVID-19 remains at 2. As of this morning, 11 individuals are hospitalized, and of that, 7 are in intensive care. 17 individuals are listed as recovered. Public health investigations continue to confirm details, and information will be updated on the website as new information is available. Yesterday, 458 tests were performed at Chatham Provincial Lab, bringing the total completed tests to 13,486. As you're aware, Dr. Tam today spoke about the use of masks in public. As more and more cases are reported worldwide, there's more and more scientific evidence to inform our decision making. As we see more and more transmission going on in the world, although it's clear that the main driver of this pandemic is large respiratory droplets by symptomatic individuals, there's growing evidence that those individuals just before becoming ill, what we call pre-symptomatic stages, may be able to transmit this infection, including some evidence that those who do not develop symptoms, asymptomatic spreading, may also occur. Although we're fairly confident that the major driver beyond this transmission is droplet spread via symptomatic individuals. Because of this, Canadian medical experts now agree that wearing a non-medical mask, even if you have no symptoms, may provide additional protection to others. Certainly the main message of staying home, of ensuring adequate social distancing at all times does not change, and by far is much more important message. But those who wanted to use non-medical masks in public is an additional way to protect those around you by reducing the chances of droplet transmission. So it should be clear that wearing these masks are very unlikely to protect the individual who is wearing the mask. It's more to protect the people around them. But again, the major message is that now is the time to stay home, social distancing at all times, especially in times when that may not be possible, then wearing a non-medical mask may be a benefit to protect others around that individual. But please do not let this distract from the main message to stay home as much as you can, to follow physical distancing messaging at all times. In addition to that, it's very important to note that medical grade masks should be in the hands of our healthcare providers. So these should not be used in public. Let's save that supply to the hardworking healthcare workers who are at the front line battling this virus. We've been asking Manitobans to take significant precautions against this virus for some time now. The social distancing strategies, the public health orders have been in effect and can be quite challenging for people to adhere to, but we know it's our best way to interrupt the transmission of this virus. These measures apply to family get-togethers, especially in the holiday season. We know Easter and Passover are coming. These measures are still in place. They apply to these meetings. We should not be having family gatherings at this time. Transmission of this virus can occur in these settings. So meet with family, stay in touch with family through virtual means. But in these upcoming weeks is not the time to have family dinners and get-togethers. Now is the time to stay home, to interrupt the transmission of this virus. We've heard various reports of church services continuing in person, and we know that it's challenging to stay away from events like this for many Manitobans, but it's vital in our attempts to limit the transmission of this virus, to flatten the curve. So everyone needs to adhere to the public health orders, and that includes faith-based organizations. We see reports of growing numbers of people out at the parks, and as we get into spring weather, it's natural to want to get out and enjoy these times. And no doubt we should find ways to stay active, whether that's a walk around the block with our family, but we need to maintain physical distancing at all times. If you're heading to a park and you see many cars there, many people, it's getting crowded, you need to turn back. If you're at the park and many people are coming, it's getting crowded, you need to leave. You need to find a place to walk, to get outdoors, to stay active, but not in large groups of people. We need to interrupt the transmission of this virus. gathering in large groups is not going to achieve that. We've had some reports of healthcare workers utilizing unproven therapies for coronavirus, for COVID-19. There are currently no proven therapies for COVID-19, so I discourage the use of any unproven methods at this point. Certainly the clinical trials are ongoing, and we need to use evidence-based approaches and science-based ways of proving effective therapies. So do not use therapies that are unproven. Leave that to the clinical trials so we can develop science on this. And certainly there is a COVID-19 research trial going on right now at the U of M. Those who have tested positive for COVID-19, household contacts, or healthcare workers who have been in contact with a proven case can call covid-19research.ca for more information. We know that there are numbers continuing to increase, and we have evidence of early community-based transmission. This is why it's more important now than ever that we stay home. By staying home, you're protecting not only yourself, but the people around you and our communities at large. Not to mention those that are most vulnerable to the severe outcomes of this virus. Those over 65, those with underlying medical conditions, those with immune compromise. We need to protect those individuals. We need to protect our healthcare workers by staying home. We all have this personal responsibility. It's a responsibility, but it's also an opportunity, right? We are not helpless against this virus. We all have that opportunity right now to interrupt the transmission chain. And the best way to do that is to stay home. We have reports of this virus in many parts of Manitoba, but I discourage Manitobans from using specific information to change their behavior, because right now for all Manitobans is the time to stay home, to practice physical distancing at all times. Do not rely on reports. Certainly don't rely on unsupported reports in social media. Acquire your information from credible sources. Manitoba.ca, COVID-19 is a great place to go to. It's updated regularly. These messages of staying home whenever you can, certainly stay home when you're sick. Do not attend your workplace if you're sick. Stay home. If you're ill, you can call Health Links for further advice. But please stay home when you're sick. This includes healthcare workers. I know many healthcare workers are very dedicated, very hardworking, and very used to working through adversity. But now is not the time to attend work, even with mild symptoms. Please, everyone, stay home when you're sick. And to encourage Manitobans to ensure that you're taking care of yourselves in other ways. Those living with medical conditions should continue to be in touch with their healthcare provider, ensure that they're up to date on any assessments that they require. Do not let other medical conditions fall out of hand during these times. Keep in touch with your physician. Many of these visits can be done virtually. So I'll reiterate that we are not helpless against this virus. We have many strategies in place right now designed to flatten the curve, to interrupt the transmission of the virus, but we need all Manitobans to work together, to stay home. If you do have to go out for necessities only, if you can, go out alone. Wash your hands frequently. Maintain that social distancing at all times. If you choose, you can wear a non-medical grade mask in public, but remember that doesn't really add any benefit to yourself. You're just protecting other people, similar to coughing into your sleeve or sneezing into your sleeve. So once again, I'll thank all Manitobans for stepping up. We've asked a lot, but we know it's for good reason, and together we can interrupt this transmission of this virus. So thank you.
Thanks. Good afternoon. I would like to begin today by thanking Manitobans throughout the province for their support of healthcare workers. We have seen and heard so many wonderful tributes to healthcare professionals, people standing outside their balcony and on their front steps, applauding frontline healthcare providers. And a few days ago, our friends at the Dauphin Fire Department pulled out all their trucks and turned on their sirens for 30 seconds to honor healthcare workers. The Dauphin Fire Chief, Cam Abry, decided more needed to be done to show gratitude for healthcare providers and everyone else working within the public during this pandemic. So he contacted some of his colleagues throughout the Parkland region, and they had a parade in Dauphin with the RCMP and drove past the local health facility. And I understand that was done in other communities throughout the province. So it's a wonderful gesture of support, and it reminds healthcare providers why they do what they do. So it's also significant because other emergency response workers like RCMP, police, and firefighters really understand the sacrifices that healthcare workers are making, and we understand the sacrifices that they make every day. So just to say to our colleagues, firefighters, police, and RCMP, thank you so much for that generous support that was provided, and it's very much appreciated. Thank you. Just a few follow-up from some questions that came up over the weekend at our media hour. One was related to staff parking, and I just wanted to highlight, I did go back and check. So any staff who is relocated to a different site as part of the COVID-19 efforts will be provided with a parking voucher so that they don't have to incur parking at their regular site and another site when that occurs. The other thing is there was questions about the concern about enhanced screening. So when staff come into the facility and have to get screened, there sometimes will be a lineup, and people are worried that they'll be late for the start of their shift. So I do just want to confirm that if you are a little bit late for your shift, you will still be paid for your whole shift. And if someone has to stay a little bit later, they will be paid for that time as well. We have heard that since implementing the screening processes last week, that it is becoming much more expedited and more efficient. And we've had quite overwhelmingly positive responses from staff who feel that this is an effort to keep them safe as well as their patients. So thanks for bearing with us through that change in process. Sometimes it does take time to get it perfected, but lots of work went in by all facilities, so thanks to all. Doctors Manitoba and the Manitoba Healthcare Providers Network are working together to identify where more physicians are required to help for COVID-19. So far, we've had 209 physicians who have signed up to volunteer to help at the screening centers, in emergency departments, and on inpatient units. And as more areas of need are identified, their helping hands will be very much appreciated and deployed wherever we can. This partnership has really been helpful. At the Bison Drive Testing Center, we were able to have 10 physicians come to work there just over this past weekend, so that was really great. And it is helpful, just that team approach. So we have physicians coming back from retirement, we have medical residents as well. So if anyone wants to volunteer who hasn't, you are welcome to go to doctorsmanitoba.ca and sign up. The other thing I wanted to discuss is PPE, personal protective equipment. So we heard from Ontario's Premier that there was concerns about PPE in Ontario, which obviously leads to concerns for Manitobans about the status of our supplies. So I do just want to reiterate that we continue to monitor the supplies on a daily basis to ensure that frontline workers have what they need. It is top of mind, and it is in almost every conversation that we have to protect our healthcare workers, and we are fully committed to doing that. Our logistics experts have been very proactive in coordinating our orders and supply distribution. And I will remind you that before we got into COVID-19, it was pretty standard that we would work with 60 vendors to get everything we needed within the province. We now are working with well over 600 vendors, just trying to manage all the changing tides that are happening. So we're exploring every strategy, though. We are looking at different vendors. We are taking donations from businesses. We are also working with local companies to potentially change the manufacturing so that it's a shift into COVID-19 supplies, which has been fantastic. We're looking at opportunities where we can reuse or reprocess equipment, and we're also continuing on with research on both those issues. So what I can tell you is no stone is going to be left unturned. We are fully committed to this. And it is a rapidly changing environment, though. I'm not going to deny that. And with the border closures and those supply disruptions, every day we have to deal with something differently. So, we do want you to know that you are our top priorities, healthcare providers. We understand the challenge. We are up for the challenge, and we are going to do everything we can to get through this pandemic together. And with that, we will open it up to questions.
Thank you. Just a reminder to our reporters online, a primary question and a follow-up question, and please introduce yourselves. From Global, Marnie.
Good afternoon, Dr. Roussin. Marnie Blunt from Global News. We're hearing from some frustrated property owners who have concerns over tenants not following proper social distancing recommendations. We're hearing of everything from parties to large family gatherings to gatherings in common areas of the apartments or condo buildings. And since property owners do not have the jurisdiction to enforce or penalize their tenants over this, would this be something that the province would look at taking enforcement measures over with rental properties?
So we want Manitobans to know that this is serious. We're taking this very seriously. We have public health orders in place that this social distancing, staying home when you can, and when you get into large groups and not following this advice, you're putting yourself and other Manitobans at risk. You're putting our frontline healthcare workers at risk. So this is serious, and we're going to take it seriously, and we're going to continue to escalate our orders as necessary. And we are continuing to find ways to further enforce these orders. So we are looking at ways to try to enforce orders in those circumstances because we need Manitobans to realize that this is serious. This is right now life and death for Manitobans. Need to act now, and we're expecting all Manitobans to follow these orders.
And my follow-up question is just regarding the face masks. We've seen a lot of different opinions on face masks and different stances from public health officials over the past week. What do you say, or how do you respond to concerns from people over public trust with health officials if stances and opinions are differing or changing?
Yeah, so I would say is that our goal here, our strategy here is to always provide Manitobans with the best advice that we can at that time. So our goal isn't to remain consistent. If we need to change our advice based on the evidence, we will. So remaining consistent has never been a goal. It's to be able to provide the best advice on the information we have at that time. And so with the masks here, My biggest issue with the announcement moving forward with it is that I don't want it to become a distraction. The real issue is Manitobans need to stay home. That's the issue. If you have to go out, you need to practice physical distancing at all times. That's a big issue. If you want to choose to wear a non-medical mask out in the public, you may be protecting the people around you, similar to if you always coughed into your sleeve or sneezed into your sleeve. Those masks are unlikely to protect the individual wearing them. So to me, I don't want it to be a distraction. The real issue is stay home, practice physical distancing. If you want to wear one of those masks, there's a growing thought that may help protect people around you, but not the individual wearing them.
Thank you.
From the Winnipeg Free Press, Carol.
Hi there, it's Carol Sanders at the Free Press. I'm just wondering about ICU beds and staffing levels. In January, we heard that there were only enough staff for 58 of a targeted 63 ICU beds in the province. So how many staffed ICU beds are now available?
So the ICU beds still remain 63 funded beds. The occupancy in the beds is actually, we haven't seen it for a long time, but it's kind of been over the last few weeks. It's sitting at about 70% occupancy. So we do have enough nurses to manage the beds that are filled right now. We are graduating more fairly soon. And we are looking at different models of care for when we have to expand beyond 63, beyond our funded beds. So we are looking at what a model of care would look like for that expansion. So conversations are already happening, looking at what kind of training and how we make sure we get the right skill set of professionals taking care of a group of patients in critical care.
My follow-up question is, we're still hearing that it's taking a week for some home care workers to get the PPE they need. April 13th is what one of the unions has told us. What's happening on that front? I'm just wondering if people are worried about home care workers not having enough and spreading the virus from home to home to home.
Yeah, so we developed guidelines, PPE guidelines, that, as you are correct, they will take effect on April 13th. And if people are able to and it works, they can potentially do some of it earlier. I know that logistics said they were working all weekend, making sure that they were filling supplies and sending them. So I think that's happening, and it could take some time to get to the traveling workforce who maybe is on the road and going to different directions, not necessarily located at a specific facility. But we will make every effort to make sure that they do get what they want. And in the meantime, we have made sure that home care providers have screening questions to make sure that the risk is low going in. And I would just remind everyone that washing your hands and keeping a distance when possible, potentially using virtual or phone solutions, those are all options that should be looked at from a home care perspective.
From City News, Stephanie.
Good afternoon, Stephanie Lasuk from City News. You mentioned earlier in that press conference about healthcare workers using unproven methods or therapies or treatments. I just wondered if you could expand on that. Are they using those for themselves, for their patients? What's happening there?
I don't really have specifics on that. I've heard from a number of experts in the field that they've had reports of the utilization of medications that are unproven. And so that's just the message that I wanted to get out, is that we have clinical trials going on. We need to rely on science and evidence-based practice. So I'd strongly discourage the use of unproven therapies. But I do encourage the process of science, such as the studies that I mentioned.
And then just one new case today. What can Manitobans really take from that number?
Nothing really. So we're going to expect some days like this, but I think we're going to expect far fewer days like this going forward. So we get one day with a low count, a couple days here now with a low count. We know that this virus is here. We know we have early community-based transmission. So we are preparing to see increased numbers, but we're doing whatever we can to flatten that curve. So I would discourage Manitobans from taking this value and putting much stock in what it means. We certainly want to see days like this, but we can't rely on this meaning really anything.
Thank you.
From the Canadian Press, Steve.
Oh, hi, it's Steve Lambert from the Canadian Press. Dr. Roussin, you had mentioned that you had seen reports or heard about religious services continuing. Is that something that you heard of happening inside Manitoba, or was that elsewhere? And how widespread do you think that is?
Yeah, the reports that I've had, and certainly not substantiated, but they were in Manitoba and in many regions of Manitoba. And so it's so we understand, these are challenging times, and people are going through challenges. So events like that bring support to people. So we fully understand this, but we just want to get that message out to Manitobans that this is important. This virus is here. It's out in the community, and gatherings like that are we know in other jurisdictions a lot of transmission has occurred in faith-based gatherings, and so. This is important. Those public health orders apply to faith-based gatherings, and we expect all Manitobans to adhere to these because it's, again, you're not only putting yourself at risk, you're putting all Manitobans at risk when you attend venues like this.
And my follow-up question is on the enforcement that you mentioned, maybe looking at other types of enforcement. In Nova Scotia, in Halifax, they've closed completely all municipal parks, including the parking lots, and they've been handing out dozens of fines, starting at about $700 per person for people who violate public health orders. Most of those are going into areas that are now off limits. Is that something you would like to see in Manitoba?
Yeah, so nothing's off the table here. So this is important. This is vital right now, especially in these next number of weeks, that we flatten this curve. And the best way to do this is social distancing. And so we have orders in place. We expect all Manitobans to follow them. And you know what? Most are. And we thank Manitobans. We know it's a difficult time. But this is important, so we're going to look at any way that we can try to enforce it to make sure people understand how important this is, that it's not only affecting you, it's affecting all Manitobans. Really, it's quite literally about saving Manitobans' lives, and so we're going to take it seriously.
Thank you.
From CTV Winnipeg, Michelle.
Hi, it's Michelle Gerwin from CTV Winnipeg. Just a question about if somebody chooses to wear a non-medical mask, what is the best way to put one on and take one off so that you're not exposing yourself to whatever may be on the surface of the mask?
That's right. So these should be cleaned frequently. When you taking them off is important, so to be careful not to touch your mouth or your eyes or your face when you're taking it off, and then wash your hands immediately and the mask. So I think there might be some advice that will come out at the online about the best way to maybe use these. But again, I don't want it to distract from the most important message is to stay home. If you were staying home before, you should stay home now still. Don't go out now because somebody has said that we can use cloth or non-medical masks. So they do serve a purpose. They can protect people around you. It's analogous to coughing into your sleeve. So they probably can benefit the people around you. But again, there shouldn't be many people around you. because we're physically distancing. So that's the big message.
Okay, thank you. And then as a follow-up, do you know anything about Manitoba diverting PPE to other provinces as some sort of sharing efforts? Or the Premier was asked about this, but he told us to ask you. So what do you know about that?
Well, I would say that the orders that we are placing, we're doing some provincially, but there's some that's also going through the federal government. And so I know they're struggling as well, just making sure that the distribution and supply chain is maintained. So yeah, so as far as I know, our orders are still flowing to us. No one's told me specifically that there's been donations from Manitoba going elsewhere, but it is really about looking at where's the greatest need right now for all Canadians. So we know other provinces are struggling. So I think right now, all orders should be coming in the coming weeks. So we're going to just keep on that track. And if anything changes, we'll be sure to let you know.
Thank you.
From the CBC Manitoba, Bartley.
Bartley Kiva, CBC. Ms. Saradusa, how many healthcare workers right now have tested positive and how many are self-isolating total throughout the province?
So we have been looking at our numbers. I have some unofficial, but we are verifying between our occupational health group and our public health information system. So we were planning on providing a weekly update for you on what that looks like, unless there's any situation that involves a risk to public safety. So we will provide you with that. But I can tell you, as of today, there was no more infected healthcare workers today than there was yesterday, unofficially. And I have not been tracking. We can look if we can find those isolating. That's a moving number all the time. It'd be hard to keep that current for you, but we can see what we can find, Bartley.
Okay, thanks. Hopefully that would be in the, you could guesstimate that to some degree. Other question here. We've been told of a couple of examples, Dr. Roussin, where people have been given information that they have false negatives. Now, knowing what we know about polymerase chain reaction testing, false positives are possible. False negatives don't really make sense. What do healthcare workers mean when they are telling people who've received tests that they've had a false negative? It's happened at least twice that we've been told.
So if a false negative is exactly that you received a negative result when it was actually positive. And so this is possible in any test, including PCR. And so in the literature, where we see this is people who have no symptoms can test negative and later test positive. And so we might determine that as a false negative. We know that in certain cases, in those that are critically ill, the nasopharyngeal swab has come back negative when a much lower respiratory sample has come back positive. So we could classify that as a false negative as well. So I don't know the specifics in those scenarios, but those are the type of things, and that's more about the sampling technique sometimes can give you a false negative. But those are the situations where it's
concerned that there's a lot of false negatives out there?
No, we would say we would determine that our term for that is sensitivity. And so the sensitivity of this test in those that are symptomatic is in the 90s, higher than 90%. And so certainly those at high risk, so those say in critical care that were suspicious for it, if their test was negative, then we might retest it. If they had certain CT findings and their test was negative, we might try to find a lower respiratory sample for that. So for the most part, symptomatic people in the community, sensitivity is really good.
Thanks.
From CBC Radio Canada, Mohammed.
Hello, Dr. Roussin and Theresa. I have a quite specific question on intensive care beds. How many intensive care beds do we have in the province in normal time, where we're not in pandemic situation? And how many of these intensive care beds do we have during the crisis? Thank you.
So the medicine beds, I'm trying to think provincially. We can get those numbers for you. And there's different levels of acuity in those medicine beds. So some are more transitional, low acute medicine beds waiting to go somewhere else. Some are more higher acute and more intense, and usually those are the ones connected with the intensive care unit. So for the intensive care beds, we have around 87, and we have the potential right now to go up higher than that depending on the needs of COVID-19. But it's really based on multiple factors, including supply, equipment, and staff, and space. But we're looking pretty good on most fronts that we should be able to increase those numbers. We still have to get the staffing trained up, but depending on the model and the recruitment, we should be able to report on some numbers with more certainty in the future.
Thank you very much.
From the Winnipeg Sun, Josh.
Hi, good afternoon. This is Josh Aldridge with Winnipeg Sun. Just looking at the number of tests completed by Chatham Laboratories over the last number of days, it seems that the numbers completed have been dropping kind of consistently there. Has the lab hit a capacity point, or are there issues in getting more tests completed, or have we just run through the backlog at this point?
There's a little bit of, it's the backlog has been run through for sure. Some of the test numbers, it requires certain staffing and certain procedures to get up at that over that 1,000 range. So certainly over the weekend, the lab isn't always running at that capacity. So we'll see again this week. We'll start seeing those numbers increase again throughout the week. But it really is a technical issue at the lab that's very difficult to run 7 days a week. So on average, you'll see our numbers increasing, but you might find certain days where the numbers are a little bit lower than other times.
All right. And just looking at what's gone on over the last weekend or so with all the precipitation that we've had, kind of increases the possibility for flooding or bigger flooding. What are the, the plans provincially when it comes to making sure people are socially distancing? If they're evacuated from their homes, where they're going to be sent? Are we looking at getting into more hotels at this point being set up through the province, or more communities? What are the measures in place to ensure that there are the proper protocols being followed when it comes to social distancing, or even just preparing for the flood through sandbags, those types of things? What's being put in place?
Efforts continue to make sure that we find available spaces throughout Manitoba, both for COVID-19 and in the event of flooding. So there's quite a few options. We have our capital planning people going to visit different sites to look at the requirements. From a COVID-19, there's obviously infection prevention and control requirements, slightly different than if you're evacuating a flood group. But we have a lot of experienced people in our emergency operations, and they've certainly done the floods quite a few times, so they know the drill and can put that into motion. It's just a matter of putting that into motion at the same time as COVID-19. There'll be lots of people making extra efforts, but it's ongoing work. It's part of our preparedness planning.
From CJOB, Diana.
Good afternoon, Diana Foxwell from 680 CJOB. Dr. Roussin, I asked the Premier earlier, but we're hearing that Western Surgery Centre, which is currently closed, has been offered to Shared Health to handle some non-COVID cases right now and could actually handle patients staying there overnight if the government were to instruct the College of Physicians and Surgeons to allow it to do so. Why isn't this being done, or why hasn't this been done, and is that something that you are looking at?
So we are having ongoing conversations with Western Surgical Center about the role that they could play. So more will follow with that.
Okay, and then as a follow-up, kind of as mentioned earlier, less than 350 tests were done yesterday. Are we seeing sort of fewer people in those populations that fit the criteria coming in for testing, and does that mean that it might be time to expand testing to more people?
Yeah, well, we are looking at expanding our testing. It was 458 tests done yesterday, and so yes, we continually look at our testing criteria, who we want to be testing, and looking at ways to expand that and also to sustain it. So we have to be careful that we don't open testing up too much and then miss the ability to test those at high risk. But we are right now testing all those that are symptomatic return travelers, contacts to cases or suspected cases, all symptomatic healthcare workers regardless of travel, those symptomatic within hospitals that are regardless of their travel. We're testing all people with symptoms in the North or in First Nations regardless of their travel. So we have opened up the testing quite a bit, and we'll continue to assess that over time.
Thank you. Apologies, I misheard figure.
From the Brandon Sun, Drew.
Thank you. That's Drew May from the Brandon Sun. Mr. Kusa, last week you made the announcement that healthcare workers will be wearing personal protective equipment while seeing patients. But when does Shared Health actually expect all the workers to actually get the masks and gloves and whatnot and be able to use them?
So shipments are going out immediately, and it's a matter of getting the orders and logistics packaging it up and getting it to the regions. The regions have to get it to the workers. So it's happening now as we speak, and our goal is to make sure by April 13th that everyone has their PPE in their hands. So it'll be a process over time.
Okay, thank you.
Thanks.
From the Thompson Citizen, Ian.
Hi, this is Ian from the Thompson Citizen. I'm just wondering, last week the Premier announced their province is seeking proposals for, low acuity hospitals if needed in Winnipeg, Brandon, and Thompson. I'm just wondering, what would be the trigger for Thompson to have that facility open?
Well, I think it will depend on what the needs of that population is who would be using that space. So if our intention actually is to keep supplies, equipment, and staff where they need to be for the sick patient that requires hospitalization. So for non-acute type patients, that may be patients who typically could go home, but maybe the home environment's not ready for them, or maybe they need home care, but the services are limited because of the situation we're in. So that would be really a place to sort of transition back home to the community. And so I guess it would depend on the level of service that is required and the volume of patients coming through the system, so that we can make sure everyone has a safe place to land, depending on their acuity needs. So right now, we're looking okay. We have space, we have staff. As numbers go up, we'll have to see. I can't really predict how fast that's going to happen and exactly when, but we will be monitoring every day and we're planning in advance, and we will make decisions as we need to expand space.
Okay, and as a follow-up, even the hospital here in Thompson a lot of times relies on workers coming from outside to staff normal operations. I was just wondering if more healthcare workers, are unable to go to work because of, possible symptoms of COVID-19. Do you think, is there going to be difficulty to maintain staffing levels up here if, out-of-town workers can't make the trip up?
I think that's always a risk that we're going to have to deal with for sure. And especially, like you said, when you're relying on out-of-province workers to come in. So yes, I would say it could be a problem. What we're looking at is making sure that we can support the sites to maintain operations. So that may mean looking at different staffing models, which we don't usually do in normal times, but these are not normal times. So there's work going on to look at what would that be. And then also really being able to support virtually. So I know in Winnipeg, a lot of the ambulatory clinics have decreased. About 80% of them are not seeing people in person anymore. They're seeing them virtually. And they're offering virtual support to their colleagues in rural and northern Manitoba. So if they need an internal medicine consult, there is a way to access a specialist, and it may be virtually, but it's still expert advice and support, and if a transfer is required, we will make it happen.
Thank you. We have time for a few more questions, if any of our
Dr.
reporters.
Roussin, Bartley Keefe here at CBC. Can you please give me your opinion on whether or not city dwellers can go to their cabins or to provincial parks or national parks, whether it's safe or advisable for them to do so if they intend to not interact with any locals, any local businesses, anyone else? Just go there, come back. What is your opinion on that?
Well, I mean, my opinion is, and you probably know what my answer is, it's stay home. That's my recommendation to everyone right now. Stay home. So now, if that's the the sort of the black and white answer is to stay home. So if you were to go just with your family, not a collection of families, just to to the cabin, didn't interact in any other way and come back, well, we're dealing with a lower risk situation there. But again, the overall messaging is to stay home. It's a challenging time right now for Manitobans, but if we all do our part, if we all focus on staying home, we're going to dramatically interrupt the transmission of this virus. And so that would be my advice.
Dr. Roussin, it's Steve Lambert from the Canadian Press. I'm wondering if you've had any conversations with municipalities and whether you would have any advice on whether they should close parks altogether. In some cases, they've closed structures within the parks and aspects of the parks, the facilities, but the parks themselves, in many cases, are still open.
So we have interacted with the municipalities. Parks are not an easy decision because there's a lot of unintended consequences to closing them. We might find people in other places that are more crowded then. So we're always looking at that, and we're looking at how people respond. We see some evidence of crowding in parks, so we're looking at that, whether we can better enforce that. And so that's certainly on the table. And so all these things we continue to look at, and it's getting nice out there. It's always a tough winter in Manitoba, and so the nicer weather makes people want to get out and be active, and they should try to be active and stay healthy. But really, it's the focus has got to be stay at home. If you did want to take in a park, you gotta be absolutely sure you can maintain that physical distancing. If you're not, you got to turn around and find someplace else.
John Aldrich, Winnipeg Sun, just looking for clarification on a couple of things. Number one, you talked a little bit about healthcare workers getting a voucher if they have to move places. What about those staying in place? Are they currently getting free parking? The other question I have is how many people have come out of retirement or come back early to help out and volunteer when it comes to the request that went out earlier for more nurses to come back into service.
I'm sorry, Josh, what was the first question? Who you were asking about who
Sure.
gets free parking?
Yeah, so just real quick, those moving places are getting a free voucher, but those staying in place, they're still getting that free parking and all the rest?
Well, if they pay for parking normally at a site, then they'll still pay for their parking. It's only if they have to travel to a different site that they would get a voucher. So they're not paying double parking, if that makes sense.
It does.
Okay.
And for the second part of that, how many nurses or other healthcare professionals that the request went out previously to come back into service to help out? Do you have numbers on how many have come back to lend a hand to the frontline workers or join the front line?
You know what? I just asked that question this morning. They've been coming in pretty steadily, I'm excited to say. So I will get you a number once I get it reported out. I just asked about 10 o'clock today. So I can get you very accurate numbers as soon as we're done here.
Sounds great. Thank you.
Okay.
Michelle from CTV. Lynette, you said that you wanted to have everyone with PPE in their hands by April 13th. So who do you mean by everyone? Can you just elaborate on that?
For sure, our healthcare workers. There's others who also need PPE. And I understand government is working with families and justice. So ideally, we're all working together to get our PPE supply. But for the healthcare workers specifically who are walking into those situations, that is our goal within the health system.
Hi. It's
Any other questions?
I have a question. It's Carol at the Free Press. I just want to know, where are the COVID-19 patients who are in ICU now? Are they all at the HSC, and has the 30-bed unit opened up for COVID-19 patients there?
The ICU patients are currently at Health Science Centre and St. Mee, and then the 30-bed unit. I'm not sure if Lynette, you know, if they've.
I do not think it's been opened yet.
Okay.
Yeah. I'll verify that.
Dr. Roussin, it's part of the key this year again. On March 23rd, you said you were reaching out to municipalities and agencies to see how enforcement could be expanded beyond inspectors. How are those discussions going?
Yeah, and so I think that there's a lot of the municipalities are reaching out and asking how they can assist with this. And so we even today we're meeting later to further see how we can enhance the enforcement of these orders, because we want Manitobans to know we're taking this very seriously, and they should too.
And Dr. Roussin, it's Steve Lambert from the Canadian Press. Has there been any discussion of using conservation officers or other provincial agents to help out, public health officers or whoever else might be enforcing these things?
There's been a lot of a review of who can be brought in to help enforce this, and so it could include a number of different provincial employees, but we're still looking at those options.
Josh Aldridge, Winnipeg Sun. I know the last couple of weeks there's been a lot of talk about modeling and trying to predict how bad this is going to get in Manitoba comparing to other jurisdictions and going off of some of their modeling. Last week we were talking about we'll have a better idea this week. Are we any closer to those kind of predictions and those types of models at this point?
Yes, we have some models underway, and so these are we're reviewing these, and of course these models are ongoing and they can change based on our epidemiology, and they need to be run many times to give us that average. And again, so the modeling numbers, as you've probably seen in other jurisdictions, are going to give a very large range. And they're just one tool that we can utilize to help prepare. And so we have to ensure that they're communicated properly. They're not a specific prediction of what will happen. They're going to tell us a range of things that would happen based on a number of assumptions. And so we have some numbers that we're starting to get now, and as we can compile those, we're going to try to communicate them in a effective way to Manitobans. But I don't know on the specifics when we'll have it all compiled.
Thank you.
Dr. Roussin, Ian from Thompson Citizen. Did you say all symptomatic people in the North and First Nations now will get tested?
They can receive a test. The advice is if you're mildly ill and without any underlying risk factors, it's my advice would be just to stay home. If people with symptoms attend in a First Nations community or in the North, they will be eligible for testing for COVID-19.
Why was that changed from before?
It's just it wasn't much of a change because we had it as the First Nations were considered remote, and so we had that as one of our prioritized samples. So including the people in congregate settings, like in prisons, we included remote settings, and so it's just a bit of an expansion on that.
Michelle from CTV, wondering what the effects the social distancing measures have had on the flu season.
Yeah, it's a good question. We've seen, decreasing utilization in beds and ICU beds during this time. It's hard to know what that relates to, if it relates to social distancing at all, but certain these type of strategies, a lot of the strategies we put in place, certainly the basic ones, washing your hands, staying home when you're sick, are effective against any type of respiratory virus. So it's hard to say what effect it's had because we're typically on the downswing now of flu season anyways, but it's a good thought that some of these measures are universal. They can protect us against a number of illnesses.
All right, thank you. We have time for one more question.
Dr. Roussin, it's Steve Lambert from the Canadian Press again. There was a media report out of Quebec this morning that said Manitoba has offered to send masks and other personal protective equipment to Ontario and Quebec because their numbers ramped up earlier and have ramped up much higher to date. Is that true? Has Manitoba offered to send equipment to Ontario or Quebec?
I have not heard that.
There are ongoing conversations with the provincial and federal logistics groups to monitor supply and coordinate distribution. So I haven't heard that either, but there are ongoing conversations happening.
Thank you, everyone. And that concludes today's media briefing.
Thank you.
Thank you.